So kind of coming back to our case here, the patient's pain has been ongoing. She presents for chiropractic with ongoing symptoms or complaints. So we needed a more detailed history, specifically showing finds that she has been working out 5 times a week, doing jumping, sprinting, and lifting exercise. She spends several hours a day on her feet and often carrying her children. So let's kind of go over some of the risk factors here. So excessive foot pronation or pes planus, excessive running, so kind of causing more prevalence of heel spurs or even stress fractures, a high arch, leg length discrepancy, obesity is one of the big ones, prolonged standing or walking occupations, great one would be military personnel, a sedentary lifestyle, tightness of the Achilles tendon and intrinsic foot muscles. So one thing that people don't stretch out a lot specifically is their calves or work the antagonist of it, which is the tibialis anterior. It's the muscle kind of sits on the front where your shin is. So if you flex your foot up like this, you'll feel it on the front side of your foot, or on your shin, I'm sorry. And that one is the one that kind of stops the movement. So those muscles need to be worked in a way that allow for foot stabilization as well. So in some cases, patients may walk with their affected foot in an equine position to avoid placing pressure on the painful heel. So kind of what an equine position is, if we kind of take a look at it, we can kind of see, here's horse, right? Kind of placing their foot there to avoid putting pressure on the actual bottom of the heel. So palpation of the medial plantar calcaneal region will elicit a sharp stabbing pain. So passive ankle or first toe dorsiflexion, kind of moving the toe towards your nose, or the big toe towards your nose, can cause discomfort in the proximal plantar fascia. So kind of in that area over here. So kind of we're flexing that tendon back, because we know that it runs kind of like that. So as we flex the big toe towards your nose, it'll cause a little bit pain there, or just some discomfort. It can also assess tightness of the Achilles tendon if this is an issue as well. Some differentials to be on the lookout for, specifically with plantar fasciitis, so such as like nerve entrapment, neuropathy, tarsal tunnel syndrome, calcaneal fracture, Sever's disease, a stress fracture, and other issues like we talked about before, arthritis, plantar fascia rupture, and the list goes on and on. So we just got to keep that in mind as the practitioner that you're going to be going to does want to do a specific and in-depth differential to make sure that it's not something else, that it is plantar fasciitis. So kind of an example here, coming back to our example patient, is that the examination finds tenderness over the medial aspect of the calcaneus. There's also restriction with the calcaneal talar articulation and the tight spastic Achilles tendons with flattening of both arches of the feet. So as the feet kind of put pressure on them and the arches kind of go down and do their shock absorption mechanism, that's when they have pain. Kind of showing you, where the heck is this calcaneal talar articulation, and kind of see it as kind of coming over here. So there is some restriction with this movement because of the Achilles heel, or the Achilles tendon being tight, thus being the muscle being tight. So something else as well is we could see the bowing of the Achilles tendon. So most people don't get this snapshot of their feet from the back side. So overpronation of the foot leads to the bowing of the Achilles tendon, and the flattening of the arch may contribute to plantar fasciitis by putting additional strain on the plantar fascia. So as that fascia kind of spreads out and it's even being more pronated, it's kind of being stretched out more. So normal here versus pronated there. So something to take a look at as well is the way that your shoes wear. So this is one of the telltale signs. One of the things that you can take a look at as well is abnormal heel wear. So this is one of those ways that you can look at, make sure, are you having normal foot pronation, or are you having overpronated feet? So you can kind of see that we have the new heels kind of there, then we have the worn heels to the side, and you can kind of see that they're being worn out because that foot is being overpronated or underpronated as well. You can kind of see what part of the foot shows pronation and overpronation. So overpronated being the middle side of the foot or the shoe, and then underpronation would be on the other side there. So you can kind of see different types of shoes, different issues. So kind of going over the foot is kind of the distal area where we'll see things